Hey everybody, it's Ellen with Mosier Family Chiropractic, and I have Dr. Mosier with me, and we're going to be discussing decompression therapy. So to start with our foundational level is, what is decompression?
So decompression is a modality or a advanced therapy targeting the disc, right? And so in our model, like we have a bone here, the white part, and then the disc is this blue part, and then obviously another bone down here. What's really cool is Ellen made me this 3D print, and I love it because it's big and you can see it. But a smaller model, you can see it's right here. So decompression, very similar to traction, only more advanced, but it opens up that disc, allowing the fluid to get back into it.
Okay. So how would somebody know if they have like a disc injury?
Okay, so there's this concept called an antalgic posture. So, and you guys may have seen this before, where somebody is leaned over or they're stuck in a forward position, usually a forward and over position. So that's usually when somebody threw their back out, right? In those simple terms, they threw their back out, herniated disc bulge. Another way of thinking of this is they constantly have injuries, right? They're constantly, their back is, if they do too much, right, at work or whatever, they don't throw their back out per se, like what we just described. Those are the extreme cases, but they constantly have this nagging flare up, right? And they need to take ibuprofen or Tylenol or even these heavier, painkillers, prescribed by medical doctors, right?
Okay. So how are you able to assess somebody in our office to recognize that this is a disc issue and that decompression could help that? What are you looking for?
So the main thing, and it's the gold standard, is the x-ray, right? When you look at an x-ray, you can see the bones, right? And so you obviously the white parts once again, and then you can see the disc. And so if the bones are, let me make sure you can see my hands, folks. And so if the disc is wedged, right? So you have disc bulging and you have closing of that space where that nerve root comes out, because I'm hoping you guys can see from the camera here, but that nerve root coming out, when you close that IVF, that opening, that space, then you have nerve irritation, right? And that nerve is right behind the disc. So you have a disc injury, what obviously is going to happen to the nerve, right? And so.
Okay. So decompression is getting the pressure off that disc to allow the disc to go back into place, creating fluid. So can you explain to us what fluid are we trying to get there, that nutrients trying to get to that disc, and then what motion does that require to get the nutrients to the disc, and how is the table being on a table, whether we're working on the neck or the low back, how is that?
I love your question, and I want to go backwards just a hair, because this is going to be a really interesting concept that explains why maintenance care in chiropractic offices, maintenance care in massage therapy clinics, or maintenance care with decompression is so vitally important, especially for adults and young adults. And so let me explain this. In our kids, we have 4 boys ranging from 9 years old to 1 year old. They have blood supply to their disc, their ligaments and tendons, the connective tissue, right? We, because we're old, we're in our 30s, I know, I think I have some gray hairs in here.
Oh, you do.
So our discs are avascular, okay? That means no blood supply. So if you are old like us, you don't have blood supply to your disc, right? And so then let's go one step back for a second. What in the world is blood for anyway? It's to get that nutrients, that oxygen and nutrients to those tissues, to those cells, right? And our cells are working just like a car working, driving up a hill, right? There's exhaust coming out of the exhaust pipe. There's metabolic waste. And so you get nutrients in and you get metabolic waste out, right? And it's this constant ebb and flow. And that's how we're alive. That's why we breathe air constantly. That's why, if our heart stopped beating for a handful of minutes, that wouldn't be good, right? Because we constantly need that. And so the disc require something else. And this requirement, it's called immobilization. That's a fancy term, but it requires movement. And so bear with me for a second. This is a lumbar model, okay? And so let's say somebody gets injured. Let's use a car accident, for example, just for simplicity, right? Somebody gets in a car accident and they shift that bone ever so slightly, okay? So as a chiropractor, I'm looking for these facet joints, these articulations, and that's what I adjust. That's what a chiropractor does, is we work on the joints. That's what we're trained in, to realign the spine. Well, the beautiful thing that's on the other end of the nerve root is the disc, right? And so now, when the disc is opened up via the decompression, it gets that nucleus pulposus. And now we're getting to your question, nucleus pulposus. That's the jelly of the jelly donut, right? And so when that opens up, it creates a vacuum effect and it sucks that back in. And so I brought a little friend. Now, you were earlier describing, this looks like something.
Yes.
Anyway, this is lungs. This is representing lungs, okay? And so...
Or boobies.
I was waiting for you to say that.
I was waiting for you to, catch you off guard.
Okay, so lungs, not breast, okay? And so this part that I'm holding here is your diaphragm. And so that muscle in here flexes down, okay? And then air gets in. Okay, so just bear with me for a second because there's a point to what I'm talking about with decompression. When you increase the volume of the chamber because of its flexing down, ambient air can get into the lungs, the balloons, okay? And so keep this in mind. When you open up a disc, right? And I'm hoping you guys can see the gapping here that's happening, the little gap right there. When that gap's open, the volume increases. The material in that, the contents of it stays the same. Therefore, pressure goes down. Okay. Now that bulging disc, that herniated disc can suck back in, rehydrating. Okay. And so by this continuing to open and close, that immobilization takes place. And so now what's happening is just like we talked about blood, where it goes to the cells and it feeds the cells and then metabolic waste out, right? Now it's getting the nutrients that it needs. So what's really interesting is, because we show the team some x-rays of our patients. So we're all on the same page because we're all working together to serve people, right? And so I'm like, well, you see this C5, C6 disc here and how it's just smashed. You got bone spurs, but then you go up a couple segments, to that 3-4, and it's perfect. It's beautiful. It's like, well, that's a great disc. Those two discs are the same age. Like, right? Because you can't just say, well, my arthritic, spine is due to my age, right? Age will allow you to get there, because you've had an injury years ago. And so now it's continuing to manifest because it never got fixed, right? Because once a joint's stuck, what's going to happen to the disc? The disc is going to dehydrate. It's going to decay. It's going to die, right? Because no blood supply, so no metabolic waste going out and no nutrients getting in. So if like a stroke, right? If you didn't have blood supply to a certain area of your brain for, seconds or minutes, what's going to happen to that brain tissue?
It's going to wither away.
It's going to die. It's going to deteriorate. A heart attack, it's the same thing. It's a cutoff of blood supply to that material. So that's literally what's happening to somebody's disc, is you're cutting it off, right? And so that's why the combination of chiropractic and massage and then the decompression works so hand in hand. Because, okay, let's talk about massage for a second. Obviously, you're the massage therapist, so there's muscles back here. And what's a likelihood of you getting all the way to the multifidi rotatory muscles?
Not likely at all.
Yeah. And so we utilize a laser to penetrate there. But you can get to the levator scaps. You can get to the trapezius. You can get to the latissimus dorsi, right? You can get to these big movers, these big muscles, and start correcting the asymmetry. And then, so we're getting layers of treatment, right, in the spine that drastically changes lives, which, since we've started this, this is what excites me, right, more than anything. Obviously, we can geek out and nerd out about, lungs or whatever you want to call these things. Yeah, I think you were saying earlier, when you were breastfeeding, when you're not breastfeeding.
Yeah. Thanks. Everybody needed that visual.
You have 4 kids. I'm sure there's other women that are watching this, and
I got you.
And I'm going to get like hate comments and all the things. But I am so excited about people's lives being changed. What's a story that comes to mind on somebody's life being changed by this type of therapy?
Well, we had a lady who came in who had tremors, and they, I don't know the specifics because I wasn't a doctor.
It's okay.
But
yeah,
she's not having those at all now.
No.
And so the unfortunate thing is we were her last option to pursue. And up to this point, she had had several misleading diagnoses, and they were scary diagnoses. So, she didn't really know what to do. So she thought, well, I got to do something because I can't live like this. So that's when she came to our office.
The person that you're talking about, she shared her story, and it should be on our Facebook or our YouTube channel somewhere, and you guys can find that. But what happened was she was pre-diagnosed with MS, right? And she had tremors, she had headaches, she had this absurd amount of brain fog. She was getting diagnosed with dementia, right? In her 50s, early 50s, right? And so that was scary. And, on our interview, she cried, right? And I'm not making fun of her or anything like that, but it was tears of joy because she was so worried about her husband, and she was so worried about, what's going to happen to him as I lose me, right? Because, dementia, it's a sad issue, and many of you may have had a family member go through that, and it's like losing your loved one twice. You lose them the first time when they're no longer fully present, so to speak, and then you lose them when they do meet the Lord. And so it's just a bad deal. But for someone to be so young to have that is pretty alarming. So of course we did decompression on her neck, right? That was her issue, and that's one thing with decompression. We can either do the cervical spine, the neck, or we can do the lumbar spine, right? And so by opening up those discs, just absolutely amazing story. Another story, speaking of a woman taking care of her husband, she had a L4, and so you got 5 lumbar vertebrae. L4 was shifting forward. Okay, so I'm going to use my 3D model. It was shifting forward. Okay, and so what that does is it causes a couple things. It causes nerve impingement on either side, but then spinal stenosis, right? Because the spinal cord goes through here, and so it chokes the life out of that. And so she was in constant pain, and her husband really isn't doing very well with his health, and she is his caregiver, right? And after a series of decompression, one, we saw on the x-rays, and that's something very consistent we see, and there's even research studies utilizing MRIs where after a series of decompression, specific decompression therapy, that disc actually rehydrates and thickens, right? One of our friends who helped us with the landing house in the remodeling, he's a good buddy of ours. He actually has fusion of C3, C4. I believe it was due to he was a firefighter and there was an accident. And anyway, he had to get that fused many years ago. Well, when you have a certain level fused, other discs work harder, get damaged easier, etc. So we did C5, C6. We just did, like last week, his reevaluation, his re-x-rays. The disc height doubled. And I don't know if I got a chance to show you, Ellen, but it was absolutely amazing. He's able to move his shoulder again. He's able to work out again. He stopped having headaches. It was a really cool thing that happens. And we could just keep sharing story and story. But what's the difference between traction and decompression? Because there's a huge difference, and we could have not spent as much money or invested as much and just got traction, but why didn't we get traction?
So with traction, it's a simple setup, basically a flat table, and then you are strapped in it just like you would be decompression. But the pull on it is not monitored, and in a way, it just pulls. It's not feeling for anything. It's not reading your muscles or anything like that. Decompression, when you're strapped in it, it goes through cycles, and it's looking out for your muscle guarding. And that way, if it feels tension against it, it's going to cycle through and not try to pull more, basically protecting you from an aggressive pull.
Yeah. It has these sensors underneath, and it's really cool because, you see all these knobs here, right? And I'll use one of these. You see all these points, these knobs. That's for muscle and ligament and tendon attachments, right? And so with decompression, we want to target the disc. We want to rehydrate the disc. If we wanted to stretch you, we would just, stretch your hamstrings and, whatever. But traction just pulls, right? And so it's just stretching all of those muscles and ligaments and tendons. So you're not actually getting the disc to be affected. You're only just getting, quote unquote, stretched, right? And this is so much more. So what would you say to the people that are like, well, isn't that like the that flippy uppy upside down thing?
Inversion table?
Yes, those things.
Well, they're not at all like that.
Yeah. So we're not going to hang them upside down?
No.
Like a bat?
No. I think that's what a lot of people, they get excited about it because it's something new and they want to get on this table because we've hyped it up to them, and rightfully so. It is exciting. It is going to do wonders for their body. But they want to know, well, okay, I understand what it's doing for my body, but how does it actually work? And it's a very simple setup that I think sometimes we don't do a good job of explaining how it's set up. So really the best way to explain it is you just lay there, and you will probably feel a little bit of the table movement, but I can't say that you'll say you feel that stretch. I think that's like the number one complaint is they get, a personal experience for the first time and their session's ended and they get up and go, how do you feel? And they go, fine. Didn't feel like it did anything. And that is the best compliment that we can get on it. Because that means it did exactly what it needed to do for them. And so for a cervical setup, you just lay on your back, your neck goes in a V holder, and you lay there, and the pillow underneath that holder will go away from your shoulders when it's doing its session, and it's all calculated on different weights. So it's specific to you and your condition. And then that's it. There's nothing more to the cervical. Same thing for lumbar. You're still laying there face up, and the pillow just beneath your bottom will go away from you towards your feet. And the only difference for that one is there's 2 straps, and I call them, you get 2 big hugs when I set you up, or when anyone in our office sets you up. You get 2 big hugs from us, and it has to be nice and tight so that the table feels you and that it has, grip on you. Otherwise, you lay there, table does its thing, you get up. Numerous times people fell asleep because they're relaxed, they're comfortable, they're not in pain, and it allows them to kind of have a calm moment in their day.
Yeah. I wouldn't know anything about people falling asleep on the table because
Yeah.
I don't ever fall asleep on the table.
Oh, never.
So, so we both receive decompression not because we're in pain, but because we want to prevent a lot of things. And I used to do strength competitions, and I've done some silly things with my spine. And the other thing, truth be told, when I was heavier, there was just a lot of compression force because I almost weighed 400 pounds. And so there's some old injuries because of that. So I'm working not only on my weight management, but I'm also working on fixing some of the things that I've done to myself in years past, right? But I want to go back for a second. So they get off the table and they're like, did I do anything? What's the next 24, 48 hours look like for them?
Right. And that varies from person to person. And as long as they're following protocol, they'll be perfectly fine. But a lot of people have noticed they're more flexible, they are out of pain, they might feel a little bit of like tenderness or like light soreness, and that's just attributed to the pull on those ligaments and tendons that you're speaking of. And the best way to handle that is some ice. We've taught that since day one in our office. And yeah.
No, I think that's great. So, okay, this is obviously more advanced than traction. So where else, besides our office, where else can they receive decompression?
If they're willing to travel 45 to an hour away, they can go there.
Okay. So this is a big deal for Washington County. Right?
Yeah. It's in your backyard. That's not typical.
Yeah. Because majority of places, they will spend a quarter of the amount of money thinking that they're going to get the same results on people. So they go cheaper. We knew better. We wanted to offer the best and the highest quality of decompression that we can find. So I think you can either go to Louisville or Bloomington to receive similar care. They may charge you a lot more, right? So let's just talk about numbers for a second, because this is business and whatever, but it's also a ministry. Like, we are on mission for people in Washington County to eliminate the thought, of spine surgery, unnecessary spine surgery. And so that includes neck surgery, back surgery, because nobody that I've encountered has had a good, successful spine surgery. It's usually consistently, they get out of pain initially, and then 2 or 3 years later, they're back in pain. And I have multiple people come to me and say, I wish I never had the surgery. One of our ladies, she has a daycare company, and she, had back surgery a few years ago, and constantly would have numbness in her leg, and she could never sit on the floor, Indian, the cross-legged Indian style, and play with the kids. It was just a very sad thing, and so she ended up getting on decompression, right, and letting us take care of her spine in that format, right. And she came into the office, tears in her eyes, just, and she had spit up on her shirt and everything, and she was just in awe of the ability to be able to play with the kids and be on the floor and read to them and be able to do the things that got her into that profession, right? And so we want to eradicate spine surgery. So when you look up what is a fee of decompression, per session, right? And what you'll see is the numbers will say 120 to 250. Okay, so 250, that's your Louisville's, that's your Indianapolis. Those are those price tags, right? Small town setting, what we should charge, 120. That makes sense because a small town, we would be on the lower end of that spectrum. Okay, we don't even charge that. And we're so on point with this ministry that because you've watched this, we want you to experience decompression without any restrictions, right? Because what we need to do, and there's it's a rarity, but we want to make sure there's some people that are just too far gone for decompression and it won't work, right? The ligaments and tendons are so injured that they won't respond. Okay. And so by testing, by having let us do a trial run of decompression on you, what this allows is us to see, is this a viable clinical option for you in your particular case? And so what we do, if you come into the office, we're going to take an x-ray, right? We want to, I don't have x-ray vision. I don't know if you picked up those goggles at the store lately.
No, they were all out.
Oh, shucks. So we're going to take an x-ray of you. We want to see, okay, what is the health of that disc that we're concerned about? And then we're going to do decompression. Okay. And then I want to check you in 2 days, 48 hours. And if it's a weekend, maybe it will be 72 hours, because of a Saturday, Sunday type deal. But I want to check on you. I want to see how you're doing. And then we can discuss what we want to do from there and how to take care for you. And so that's what we want to do. So do you have anything to add?
No, I don't think so.
Okay. Well, thank you guys for tuning in, and I look forward to seeing you soon. Go ahead and message us or call the office. Our phone number is 812-883-9779, and let's get you scheduled for your free trial run on decompression. I look forward to seeing you soon.